Dear students, today we are going to begin with your third supplementary, The First Patient, written by C.V. Burgess. The First Patient is an amusing play written by C.V. Burgess. This is given in the format of a play, which means a kind of conversation. It reveals the humorous situation in a dentist clinic. First, let's get some knowledge about the author C.V. Burgess. Christopher Victor Burgess is known as C.V. Burgess. He is a humorous playwright. His situational humor intensifies the emotions of the characters in the play. His plays usually accommodate a number of characters. His famous works are short plays for large classes, Teach Yourself Speech Training, and Classroom Playhouse Words in Action. The characters of the play are men 1 to 8, which means 8 men are there, nurse, women 1 to 8, which means 8 women are there, little girl Dorothea, dentist, and a small boy. So the scene begins in this way. When the curtain raises, the following characters are seated in a dentist waiting room. Women 1 to 8 and men 1 to 8 are seated in the dentist waiting room. Some of them are reading magazines or newspapers and spending their time. Man 4 has a rough bandage tied round his jaw. He is holding the bandage and groaning. Groaning means crying in pain. Man 3, woman 5 and woman 6 are just entering the waiting room. The conversation among the people starts now. Woman 5 is telling that we'll have some time to wait before the dentist sees us here. So she is telling this to woman 6. And woman 6 is replying as, so I see. They both are talking that we'll have some time to wait before, as the dentist has not yet arrived, she is telling that we need to wait for some time. And woman 6 is also replying in a positive way. Women 5, but I'll show you some of my holiday photographs to pass the time. So woman 5 character in the story is, the whole story she is keep on showing the photographs to others. Man 3, women 5 and women 6 sit. Woman 5 takes a packet of photographs from her handbag. Throughout the play, she concentrates on showing her photograph. So all are sitting there because the dentist has not yet arrived to the dental clinic. And by the way, woman 5 has started to show her photograph. Man 5, what time do you make it, Jack? Man 6, almost 8:30. The dentist should be along any moment now. So man 5 and man 6 are discussing about the time they arrive. Women 6, isn't it a dreadful hour of the morning to see a dentist? I'm not half awake yet. So women 6 is explaining that she is not even half awake, but they are there for the early morning hour. Man 5, I hope you won't be long. I'm going to be late for work anyway. As the dentist is being late, the people are very confused and they are telling that Man 5 is telling that he is going to be late for his work somewhere. Man 6, something should be done about dental hours. I've always said so and I'll go on saying so. Enter nurse. So man 6 is telling that dental hours is always taking late. We should do something about it. I've been speaking about this for so long. And by the time nurse enters, woman 6, good, the dentist shouldn't be long now. On seeing the entering of the nurse, woman 6 gives a positive sign that the dentist shouldn't be long now, even he will be arriving now. Women 5, and this is one of the boarding houses at Wadling on Sea, our boarding house. Those are the steps I fell up, we nearly died laughing. As I told you already earlier, woman 5 is explaining her photograph. She is showing one of the photograph at Wadling on Sea. Woman 6, it looks quite a nice place. So woman 5 was showing her photograph from Wadling on Sea to woman 6, and woman 6 exclaims that it was a nice place. Woman 5, oh it was, and the landlady was a dear. So woman 5 was telling even about the landlady of the Wadling of Sea boarding house. Woman 5 shows another photograph. This is one of hers. You can't quite see her face. You see my finger got in the way, but she has such a nice face. So woman 5 was telling about the landlady that she has such a nice face, and woman 6 also accepts it. Enter woman 7 and the little girl. So while the conversation was going between women 5 and women 6, there enters women 7 and the little girl. The name of the little girl is Dorothea. Women 7, oh, do come along, Dorothea. Little girl, I don't want to see the dentist. I won't. So, how does a child react when he or she goes to the doctor? Normally, children used to hesitate going to the doctor because they are afraid of injections, tablets, always. The same way, Dorothea also hesitates to visit the dentist. Women 7. Now, Dorothea, remember what your daddy said. If you won't have your teeth seen to, no more ice lollies. So, women 7 is the mother of little girl Dorothea. She is warning that, don't you remember what your daddy said? If you don't look at the dentist or if you don't visit the dentist now, you will be no more having ice lollies. Ice lollies means ice pops, okay? How your mother or father used to scold you, no more chocolates. The same way she is telling no more ice lollies. Little girl, I don't want any ice lollies. So Dorothea is feeling that she have to reject ice lollies instead of visiting the dentist. The little girl is dragged to her seat by women 7. She sits weeping. Man 4 groans loudly. So now women 7 is dragging little girl Dorothea to her seat. She sits weeping. Weeping means she is started sobbing or crying. Man 4 groans loudly. Man 4 is groaning in pain. Women 4, here is the dentist. So now the dentist has arrived. Women 3, and about time too. Enters dentist. Dentist, could I have the first patient please? So dentist is calling the first patient. Exit dentist into surgery. So now dentist is exiting into the surgery room. Women 1, that is you Joe, man 1 and women 1 stand. So already we know the dentist has called the first patient. So women 1 is telling to man 1, you are the first patient, you can get inside. Man 1, yes, that's me. Women 1, now make sure he pulls out the right one, Joe. So women 1 is warning or telling to man 1 that make sure that the dentist pulls out the right teeth. Man 1, I will. Women 1, goodbye Joe, I will wait for you. Exit man 1 into surgery, women 1 sits. Now, woman 1 is giving a send off to man 1 into the surgery room and she is waiting for him outside. Women 2, I believe the dentist is ever so good. So, women 2 is giving a positive review for the dentist. Women 3, yes, he took out 6 for Mrs. Johnstone and she never felt a thing. So, women 3 is also adding some positive points to women 2 because she is telling that he took out 6 tooth for Mrs. Johnstone. Previously, some other Johnstone may be a neighbor or someone else who is known to women 3, and so that she is giving a positive review how the dentist has treated Johnstone without without any pain. Enter woman 8 with a small boy. So now woman 8 is coming with a small boy to the dental clinic. Women 8, now Maurice, there is nothing to be afraid of. Maurice is none other than small boy. The name of the small boy is Maurice. So she is convincing him, Maurice, you need not be afraid of anything. Everything will be alright. Small boy, I am not afraid. But the boy was too brave and he was telling that I am not at all afraid. Women 8, just a little pull and ever such a weeny tuck. Weeny tuck means a small pull. Okay, that is called as a weeny tuck. And all the pain will be gone in a fraction of a second. Just a little pull. You need to wait just for a second. Small boy, there is no need to treat me like a baby. I'm not afraid of a dentist. So the boy was very brave and he was answering like, don't treat me like a baby. I'm not a kid. I'm no more a kid. I'm not at all afraid of a dentist. Woman 8, now sit down quietly, Maurice, and I'm sure the nice dentist won't be long. So she is asking him to sit down and they are waiting for the dentist. Small boy, I think I'll get a magazine. I feel like reading. So Maurice is acting in a matured way. Since he need to pass time there, he is telling that he feels like reading a magazine. The small boy goes to the table and looks to the pile of magazines and newspapers. So he is looking through the pile of magazines and the magazines arranged in order and newspapers, and he is picking one of that and he sits for reading. Woman 8, alright dear, just as you like. The mother is also permitting him to read. Woman 8 sits. Man 5, I'm going to ask for gas. I'll never forget the last time. Man 5 is telling that he is going to ask for gas. Gas here refers to anesthesia. You know what is anesthesia? Anesthesia makes us to get relieved from pain for that minute. I'll never forget that last time because he might have suffered a lot during the last time. So now he is telling, I'm going to ask for gas from the dentist. Man 1. I knew a chap once, he asked for gas. It was the last time he ever asked for anything. Man 1 was telling that I also knew a Chapman, a small boy. He also asked for gas. It was the last time he ever asked for anything. Man 2. Is it a fact? Enter nurse from the surgery. She walks across the stage and exits left. So now nurse is entering into that room from surgery room, and she is walking. Already this is told as play. Okay, a kind of conversation play. So now she is walking across the stage and exits to the left side. Man 4. I shouldn't ask for gas or any of these drugs either. It's unnatural, I say. Give me the old fashioned methods. So man 4 was telling that I don't like asking anesthesia or any kind of drugs to cure my pain. I think that is like an unnatural way. So I'm going to follow the old fashioned methods, which is going to happen without any drugs. Man 5, you can have them, I'll have it without the pain. So man 5 is telling to man 4, you go for a natural method, I'm going for an unnatural method. Woman 5, and you will love this one, dear. So already I've told you, woman 5 is doing the work of just showing the photographs. So for the whole story she is keep on showing the photographs, and woman 6 is also watching those photographs. Woman 6 is telling, I like that, I'm sure I will. Woman 5, it is one of me riding a donkey along the sand. So woman 5 is showing the photograph of her riding a donkey. Part 2 will be continued in the next video. Thank you.